What is your case?
Dr. Sparias and Dr. Patakos for the kind invitation. I will be presenting another Percival case where we faced a rather unforeseeable, not complication, but difficulty. We did this case a few months ago with Drs. Vaina and Dimitriadis, and the case will be presented in a few days in EuroPCR. So, this was an 84-year-old male with severe exertional dyspnea. 4 years ago, he had undergone an AVR with a Percival, 23 millimeters, severe degeneration of the valve with a mean gradient of 64 mercury per millimeter. So a decision was made for transfemoral valve-in-valve. Pre-procedural CT showed that there was good peripheral access. So seemed to be a routine case. At the beginning, right femoral access, we plan to implant a 26 millimeter evolute valve. We spent some time to cross the valve with a wire. After we crossed, we put a Landerquist wire down into the ventricle. We had significant difficulty, though, to cross the Percival valve with the evolute valve. The problem was that the tip of the transcatheter valve was actually impinging on the upper border of the frame of the Percival valve. We did several attempts. We tried to pull the wire, slightly push the wire, rotating the delivery system of the evolute valve. However, after trying to cross the valve for about 20 minutes, if I remember well, we had been unable. The evolute valve was always stacking, as you see there, on the superior border, was impinging on the superior border of the Percival valve, and we couldn't push more. So, sorry, excuse me. So you can see the problem here. The valve we were trying to go through, impinging of the tip of the transcatheter valve, of the evolute valve, on the upper border of the Percival valve. So we changed operators, we did several things. We couldn't cross, we couldn't advance the evolute valve past the upper border of the Percival valve. So we decided to use a snare. This technique has been described in the literature. So we removed the wire from the ventricle. We put a snare, a goose snare catheter from the left radial artery. We crossed the valve again with the wire was snared, the catheter was snared. After crossing the valve with a new straight wire, which was snared, we exchanged this wire through a pigtail catheter for a new Landerquist wire. We advanced the evolute 26 millimeter valve through the snared Landerquist wire. We had to be very careful so that we would snare the evolute valve just proximal to the capsule of the valve. So by applying gentle pressure when we're trying to cross the Percival valve, we would kind of redirect the valve at the center of the Percival valve. It seems this worked. So you see here, the evolute valve is down, gentle pressure is applied through the snaring device. And at the end, we had been able to redirect the evolute valve and put it through. So we removed the snare. After that, the evolute crossed easily. And we implanted the valve with routine techniques. With a good result, no significant gradient. The patient has been doing well after 4 months of follow-up, if I remember well. Thank you very much for your attention.
Very well done, Kostas. Any questions from the panel or the floor, maybe? Okay, Kostas.
Costa, thank you. Great case and great save. This technique has been used a lot with old core valve and now evolute. It seems that the capsule of this valve is quite stiff, so if it stacks, it stays there. So I wonder, for all these cases with Percevals we've seen earlier, Petros, your case, other cases yesterday, why to put a supraannular self-expandable long valve with so much metal in another valve that also has a lot of metal? Because essentially you exclude any access to these corners now. You have two networks of metals there, and also you exclude another TAVI in TAVI in case you use it. So why not choosing a balloon expandable valve in these cases?
You're absolutely right. TAVI in TAVI, I don't think this would be an option in this particular patient. The patient has been 84 to 85 years old. You're absolutely right. I think a balloon expandable valve would be a great option here. However, at that time point, due to logistics in our hospital, we have to go through and use this valve.
Okay. Thank you. So, our